guys, Marissa with Redemption Physical Therapy. I wanted to come to you today and talk about PAILs and RAILs. These are things that you probably have heard at least once or twice. You may have even used them as techniques and not even known it. But what are PAILs and RAILs? First of all, they're acronyms. So PAILs stands for Progressive Angular Isometric Loading. RAILs is just Regressive Angular Isometric Loading. And those definitions will make sense in a minute with the example that I'm going to give you. But why do we use them? So we often use PAILs and RAILs as a mobility technique. So they've been found to promote more long-term changes in mobility versus these short-term changes that we get from static stretching or the typical stretching that we used years and years ago that's really becoming outdated. So the example I'm going to use is for hip external rotation. I'm going to use my left leg. The first position, and I'm going to go through a typical PAILs and RAILs protocol. So the first position you would do is you would get down into like a pigeon pose. So that's going to promote that end range external rotation stretch of my left leg. Of course, the other leg you would just put in front if you wanted to use your right leg. From here, the typical protocol would be a 1 to 2 minute stretch. Again, the typical protocol will be different from person to person or different for what you're trying to achieve. But the typical is 1 to 2 minute stretch. You can kind of bend down here to gain some more stretch through those external rotators. After that 1 to 2 minute stretch, you're going to go into the PAILs. So that progressive angular is just increasing the angle of the external rotation. The isometric loading comes from the contraction phase. So what I'm going to do is I'm going to drive my knee into the ground. That's going to promote increased external rotation, and the isometric comes from the fact that I'm not having any joint movement. So I'm producing muscle torque, but there's nothing happening because the floor is stopping me. So I drive my knee down, try to promote more external rotation, and I'm going to hold that for 10 to 20 seconds. It's a max contraction, so it shouldn't be painful, but you should be pushing as hard as you can. After that 10 to 20 seconds, we go into the RAILs portion. So the RAILs would be utilizing the musculature on the closed side of the joint, the muscles that are shortened right now, my internal rotators. So the way I would do that is I would block my knee with my hand and push up into my hand. Again, no movement is occurring because I'm blocking with my hand, but I am producing muscle torque. Another 10 to 20 seconds there. After 10 to 20 seconds of both of those, you can hit another 1 to 2 minute stretch. You can perform this cycle more than once, but that's the typical cycle. So what did we do with the PAILs and RAILs just now? So the first thing we did was is a neurophysiological response. So by training the body to produce muscle torque at end ranges, at end range external rotation for that example, we're allowing it to become confident but with utilizing that motion. So that's going to turn into long-term changes because the body is going to become confident with getting into the bottom of a squat, for example, because it knows that we can produce a muscle torque there. From there, being able to get into that bottom position or whatever position we're trying to achieve, one, we're gaining mobility. As we consistently use them, that mobility will stay with us. And we're also going to translate that into strength because it's going to allow us to perform the exercise correctly, and it's going to allow us to load the weight because we have the torque production in those end ranges. It's also going to help us by using that RAILs, the regressive angular isometric loading. We're going to strengthen the other side of the joint because both sides of the joints have to be strong. And this is going to allow us to be able to actively move freely through these ranges of motion because we have the strength to get through them and we're not being stopped by that neurophysiological tightness that we tend to perceive. So try these PAILs and RAILs. Contact me if you have any questions. They can be used for a number of joints, but that was just for the hip.